So thank you everybody for joining. We'll be chatting today about our experiences trying to develop new tools for measuring experiences with WASH in schools and healthcare facilities. And I'm excited that we have a really great team here, a lot of folks who I've worked with for a year plus, getting to meet them in person. So really great to be at the meeting and be able to present these findings. This has been quite a bit of time in process. So we'll kick things off with just an overview of what this project is and what we're doing. Some of our experiences with implementing these new tools in Nepal and Uganda. We'll then turn it over to some of our folks who have been also implementing and using the WISE suite of indicators. And then hopefully we'll have some time at the end for you all to get to interact with these and provide feedback and comment on where we should take this. It's still early days, so any sort of feedback is greatly appreciated. And so I'll start this off by actually switching over to Sarah Young, professor at Northwestern, and some are calling the matriarch of these experiential scales. So Sarah.
Thanks everyone. Thanks for coming indoors after what I hope was a lovely outside lunch for you. So it's a pleasure to be here, and I don't think I need to convince anyone in the room that measurement matters. And it matters because what we measure is how we understand what we're doing, if it's working or not. And you know, we want to be measuring accurately. I think we can all agree with that there. And what I started to learn 10 plus years ago now, is that supply side indicators are really important. They matter a lot, but they don't tell us the full story. So this is a woman in Western Kenya, Hadija, who was telling us about how she was having these problems with water insecurity, that in fact she's this pregnant, caused her to go into premature labor of great risk of health to her and her baby. But if we were measuring her water insecurity using standard indicators, we would see that she had on-premise infrastructure. And we would see that she had Lake Victoria not so far away, and so there's water physically available. That didn't tell us that her mother-in-law, far left, wasn't letting her access the sim tank that was there. So what we learned from that is that we need to ask people how water is showing up in their lives. You've probably heard me, can I say blab on and on about the water insecurity experiences scales. I'll be doing that for the next couple of decades, so if you haven't heard me, I'll be happy to continue. But what you can see is www.yscales.org. You can see these items up there. And I'll give you like a little bit of a backstory on kind of what this has meant for implementation. So big thanks to Oxfam, who were some of the earliest adopters as implementers of WASH programs. They were really prescient. Shout out to Janie Vonk for adding the WISE indicators to evaluate this implementation, this small project in Sierra Leone. And in fact, brings me to some swag. In this report, we highlight what Oxfam did and didn't find, and what I'm going to be talking about here. But what we saw is that in their comparison to, was this a before and after comparison, Josh?
This was an intervention where they had a matched group that did not receive. But
okay, so this was not before and after, this was a matched set of villages. And what we can see is that in what we're calling these the comparison households, that people with improved, there was a greater proportion of people with improved drinking water. There were fewer people with bad service, and there were more people with at least basic services. So this is good, but this doesn't quite get our paws dirty to really understand how water was showing up in their lives or not. So that kind of information was complemented by these 12 questions that take 3 minutes to administer. And what we can see is how these different experiences with water, worrying about water, having to change food because of problems with water, not having any water to drink, how that was really shaped by this intervention. And we can see what wasn't still, it wasn't a perfect intervention. Not everyone was scoring 0 on the Y scales. I don't know if anyone would ever score 0. But the point is that this gave us insights that we wouldn't have had otherwise. So I have a couple of copies of this impact report that we launched at the Gallup headquarters in March. And it's nice to see that people have been listening. I'm a mother of 2 daughters. And I'm really good at repeating myself because that's how you have to get through sometimes. And people are listening to and it's not just me. There's just dozens and dozens and hundreds now of people who are working on bringing the human voice to the water sector with these scales. You can see that we now have nationally representative data for a number of countries, 40 plus, and as well as a lot of site-specific data. And yeah. Up here are manuals for implementation. They just came out on Friday. I'm very proud of them. And I'm going to flag for you page 20, which is particularly germane to this discussion. As you can see some of the FAQs about which scale to select, which recall period, and the spider diagram that implementers have found to be useful in showing what it is that they've done. Now, scale development is a huge pain in the ass. It's really hard to do. In fact, I'm looking at Ian in the audience who kind of caused us to make an abbreviated Y scale way back when. And, I blame him for it and I really thank him for it. And I'm gonna do the same to John Brogan. So John was like, hey, Josh, hi, Sarah. Who knows John Brogan? I mean, we all know John Brogan, yeah. Great scale. Hey, we're using it in Nepal. They're putting it in thousands of households in Madagascar. I mean, God bless John Brogan. He was like, but what about if we make a scale for institutions? And my first word was, hell no. It's really hard. I mean, scale development is not for the faint of heart. I mean, it's highly political. It's really cognitively burdensome, but it's also so important how we measure things. And, who can say no to a face like this? So, John made a great case for doing more scales. I do not think of myself as a scale person. I'm trained as a nutritionist and anthropologist, but somehow this is what the universe has brought to me, and we're doing it. And this is not me. This is especially all the people here sitting in this room, but there are people online. This is a massive effort that turns out to be, I think it will be very valuable. So we know WASH is really informative of school attendance and performance, risk of infectious diseases, student, patient, and staff satisfaction, dignity and safety in schools. We want good WASH stuff.
You can pass it.
Yes, I
didn't have a great transition.
Okay. And Christina's going to tell you all the other stuff. So please, I encourage you to just take a WISE Scales pen, look at the manual. You don't have to take one of those, but make sure you do your homework at the end of the session.
Hi everyone, I'm Christina from Helvetas, and I am definitely not John Brogan. I am a poor substitute for what was really pushing Sarah and Josh to think about this from an institutional perspective. And again, these were all the reasons why we really felt like we need to expand this to schools and healthcare facilities. So talking a little bit more, this is, all of you are very familiar with JMP indicators. This is currently kind of how we measure things, and more or less we really kind of only measure what we can observe. I mean, obviously we take water quality measurements, but this is really snapshots in time on what we're seeing in households, and it's mostly around service provision. So we see this potential to expand these indicators. And I think just looking at this diagram here, at this picture here, what you see is what is likely a basic sanitation service based on JMP indicators, but we're not answering questions like, can students actually access it? Is it adequate for them? And is it actually used? So we really wanted to dive a little bit deeper into these questions. And I actually love this diagram that Terre and Josh use a lot, which really kind of says, what are actually all the things that we want to measure when it comes to WASH? And we think about availability, accessibility, and use. And when we talk about the JMP indicators, they're really, really, really good at the service provision piece. We can really nail that down, and we can start to look at accessibility, kind of getting into that area. But all of these other things are really hard to measure, and we don't have good indicators that help us measure these, at least efficiently and effectively and cost efficiently. So measuring users' experience provides some of these meaningful insights. And one of the things I was saying about that kind of range of different indicators is it is really impractical to quote unquote objectively measure all of those things. There are a lot of folks working with sensors. Those are awesome digital sensors. There's people doing structured observations in households. I think from I'm an engineer perspective, like I love objective measures. Like I am guilty of the 10-page survey that like wants to dive into every topic and yesterday and when you go to the market, does that change and all those things? That's really impractical, frankly, for a lot of folks, and we get these lengthier surveys. And so a lot of what Sarah and Josh's research has done, even on the food nutrition side, has shown that these scales, measuring people's experiences, is one of the most kind of efficient ways to look at all of these different indicators. And again, they also, benefits really provide insights into users' satisfaction. So we do have a lot of partners that are using this kind of as their customer satisfaction survey, and how they use and benefit kind of from these WASH services. I think we had an event on Sunday night where we talked to a lot of folks that are using these scales, and it was so interesting to me to learn from people that I consider to be like engineers and hard measurements people, and they were talking about, I just love understanding users' experiences. So I think that's so cool to kind of see that aspect of all the scientists and engineers that are typically in this room. So shifting now, what are we doing? So there's this depth of experience on the individual and household level, and now we're trying to transfer that to the institutional level. So we're developing scales, that wasn't clear, at schools and healthcare facilities globally. The scales will not just do that, but expand this research and policy community by quantifying the magnitude of these issues, identifying experiences that happen specifically in these institutions, schools, healthcare facilities, and inform kind of the development of these interventions. Again, we really do hope to see more and more of those before and after studies. What is changing? Why? Can we look at these why scales at the beginning and say, what are we learning? How can we take those things and implement them in the programs? So I'll pass it to Josh on how do you develop a scale?
Thank you, Christina. Very carefully. Yeah, so thank you again. So much respect and gratitude to Helvetas and all our other partners for helping to push us in this direction and think about it and work on this collaboratively. So as Sarah mentioned, scale development is a long and arduous process and not one that I thought I would find myself in either, but here we are. So scale development, I think of as having kind of three main phases. The first phase is you're wanting to think about how are you actually going to measure or develop the right questions to measure this. It's called construct, but you can basically think of that as the underlying thing you're trying to measure. And in this instance, we are trying to measure water, sanitation, hygiene, adequacy, insecurity among users in these facilities. So we searched the literature to see how people are historically and traditionally measuring WASH in institutions. That's everything from user satisfaction surveys to the more infrastructure-based of counting number of toilets, the quality of the toilets, whether they have locks or not. And so with that, we created a list of, it varies depending on the target population, but anywhere from 30 to 40, 50 experiential items that we thought were really good. We then sent them to a bunch of experts, some who are in the room, and they provided feedback and said, those are really bad items, those are really good items, you're gonna wanna totally change the phrasing of that. We took their advice and did that. And came up with a set of potential items that we wanna go out and pilot and test. So they kind of take the form of how they were in the household and individual level, but something like, for instance, this is in a school setting for staff. How often in the past 4 weeks have you insert experience here? Worried there would not be enough safe drinking water, drink water that you thought could make you hurt, or make you sick, could not concentrate on school activities because you were thirsty. So there's way too many items in this, and the next two phases of the project are trying to figure out which ones are actually the core set of indicators. So targeting back to the household and individual level, that started with like 30 questions. Nobody has the time or capacity to ask 30 questions, narrowed it down to 12. We're hoping to do something similar here. We don't know what the magic 15 or 20 items are going to be, but hopefully something much more smaller and scalable. The second phase is scale development. That's where we're at now. We go out and we actually implement and work in the communities to understand how are people understanding these items, how are they responding to them. So where are we doing that? We'll hear from some of our implementers in just a little bit. Uganda, many thanks to Eawag, our partners there who have implemented in both healthcare facilities and schools, and forthcoming data collection on the horizon in Nepal, Rwanda, Ethiopia, Ghana. Additional sites where you may be working, you'll see that shortly. And kind of what's on the future horizon. So we're collecting all of these data and we're getting really useful stuff to do in the moment. So we are trying to transfer those results immediately back to the communities in which we're collecting them. But in order to make a truly globally comparable scale, we have to get data from a lot of sites. So we anticipate continuing to collect data through maybe 2025, and then shifting to this third phase where we analyze the results, do some fancy statistics on the back end, and figure out through confirmatory factor analysis, item response theory, pick your flavor of analysis, we'll figure out what's that core set of indicators. To give you a sense of what we're actually doing on the ground in phase two, we're piloting in multiple sites, and we're selecting sites to try to capture. These are not supposed to be representative or nationally representative data sets. We are trying to stress test these items and see whether they perform well in different settings, different types of populations, different characteristics and backgrounds. So we're trying to get really heterogeneous populations. There's three main types of data collection that we're doing. The first is cognitive interviews. So that's just a fancy way of saying that we're asking people of what they think about the items. When we ask them the questions, how are they conceptualizing it? How would they go about responding to it? Once we refine the surveys a little bit based on that, we then implement the surveys to several hundred people. And at the same time that we're implementing those in the schools and healthcare facilities, we're collecting the traditional metrics to compare these experiences to. That means the number of toilets in a facility, the number of water taps, and the functionality of those at the time of survey. Sample sizes, as I said, cognitive interviewing, a handful of people, about a dozen plus for the different types of populations. And then the actual surveys are typically looking at around, ideally 250, 100 to 250 is normally good for scale development projects and the types of analyses we have to run. Cognitive interviews, this is to give you a sense if you're thinking about wanting to join and help out. Take about 30 minutes to implement. Our partners will tell you it takes maybe a week or two to do the cognitive interviews. Then the surveys take about only 15 minutes each to implement. And alongside asking about these water insecurity experiences, we're asking about their backgrounds and satisfaction with the services to compare the experiential items to. So seeking partners, need additional sites. This is truly a all hands on deck effort. So if you are currently working in schools or healthcare facilities and think that this would be useful or want to add on, please talk to me or Christina afterwards. I'll flash up our emails. But it's really great, in particular, if you already are doing monitoring about efforts and just want to plug these in. It's not a small ask to add those in, but it makes it easier if you're already implementing and working somewhere. And that's how we found it to be most effective with our other partners. And to give a lot of thanks to our current implementing partners, including folks at University of Colorado Boulder, Splash, PATH, Eawag, Helvetas. And resource partners, I like that term. Christina, resource partners, that means money. If you want to give money to this project, also it's not cheap and we want to appropriately compensate both participants and the enumerators who are going out and collecting these important data. And what can we offer you? So hopefully a wealth of information and resources to make this as easy as possible to implement in your site. So we already have ethical approval from Northwestern. That's the primary site of the Institutional Review Board, but we also need to get local approvals, and we've been trying to make that as easy for our partners as possible by providing them with abundance of text and other forms. We have the consent forms, we have the survey forms, programmed in several different electronic survey methods, and finally, to work with us are hopefully fun and bring some levity to the project as well. I'm gonna pause there and turn it over to Kia, who is speaking on behalf of Hilton, who has so generously supported this project, and without them, we would not be at this stage of implementation. So, yeah, thank you.
Thanks for the introduction, and thanks everyone in the audience and online for being here today. And I'm sorry, my speech is probably the most boring, and so I just have to stare at my face rather than have interesting slides. But my name is Kia Rydell. I'm a program officer at the Hilton Foundation with the Safe Water Initiative. So the Hilton Foundation seeks to improve the lives of people living in poverty and experiencing disadvantage around the world. And the Safe Water Initiative is focused on system strengthening and service delivery to ensure sustainable, professional, safe water services to rural communities across sub-Saharan Africa. And so we also support our partners to generate evidence to inform regional, national, global actors with the end goal of improved health and socioeconomic outcomes. So we are supporting the InWise project and supporting the InWise project as part of that. And I just want to give just a quick overview as to how we got involved and why we're supporting. So every year our team goes to World Water Week in Stockholm. And while I like that conference for many reasons, some of the sessions tend to not be the most engaging, and for anybody who's organizing UNC, I promise I don't say that about this conference. But you know, in 2023, most of the sessions I attended tend to blur together, but there was one in particular that stood out to me, and it was a talk show on the feminist water agenda that featured Sarah Young. And so when I was sitting in the audience, I was struck by the things that she was saying, because she said that the sector needs to be able to talk about water and gender in a quantifiable way. And she introduced the Y scales as a way to be able to measure at the level of the individual, to be able to determine who and who isn't being left behind on SDG 6. And so I come from a data and research heavy background. So hearing her talk about the feminist water agenda, using terms related to sampling techniques and survey methodologies, I was instantly intrigued. So I came back to California, set up a meeting with our monitoring and evaluation, or our learning and evaluation officer at the foundation, and told her everything I've learned about the Y scales, which I never told you this, but then I found out I was late to the game because she had already been in conversations with Sarah about supporting the adaptation of the scales to institutions. So I think we're really excited about supporting this project because the benefits of being able to measure WASH insecurity at the institutional level has enormous benefits in terms of being able to better target resources, be able to measure interventions and evaluate policies. And you know, so I think like overall we're, so it's, you know, and I think you heard earlier that with the existing Y scales, a number of governments and NGOs around the world have already adopted those indicators as a core part of their monitoring and evaluation efforts. So we think that this will be similarly transformative for the health and education sectors. So with that, I just want to encourage anybody who's interested in supporting the InWise project, either through funding, so I'm looking at any WASH funders in here, or anybody who's interested in implementing in the projects that you're doing across the world. I highly encourage you to join the growing consortium for the InWise project. Thanks.
Consortium, so we would love to continue to expand on the bottom of the slides with the number of partners that we have. I want to also recognize we've been doing a lot of talking. There will be a moment for questions, but I think some of the questions that I could already maybe anticipate folks may have may be answered by some of the next upcoming presentations. So I'm going to jump into those, and I'm going to turn it over to Madan, and I owe many thanks to you as well for helping to lead this project in Nepal. And then afterwards, we'll hear from Marissa, who's been implementing it in Uganda. So I'll let Madan speak on experiences thus far with trying to use these tools. So, Madan.
Thanks, Yos. Good afternoon, everyone. This is Madan from Nepal, and my colleague Christina is also here. If I miss anything, she will also compliment on this presentation. Let me briefly give overview of our WASH sector in Nepal. And there are about 29.1 million people living in the country. Our constitution has enshrined that this access to WASH is a fundamental right. And our country is also committed to SDG Goal 6. At present, this water supply coverage is about 91% as a basic water supply coverage. However, this safely managed water supply coverage is far below, which is 16% only. And the sanitation coverage is 99%. The country has been declared with ODF in 2019. And safely managed sanitation is only 62%. Here is the situation of WASH in school. I will not go through all the data, and it has been taken from JMP. If we see the coverage in terms of drinking water and sanitation, it's around 80%, including basic and limited. However, for this hygiene, the coverage is far below. Similarly, here is a coverage of WASH in healthcare facilities. In terms of water, we have a good coverage. However, in terms of other indicators like this waste management and cleaning, we have a very poor coverage. Now, I would like to briefly introduce about this integrated water resources management program of Helvetas, where we piloted this YG scale, and we have planned to test in YG scale as well. This program has three outcomes: access to improved WASH services. A second outcome is multiple use and climate resilient WASH. Third outcome is WASH governance and advocacy. Through these outcomes, we believe that human right to water and sanitation can be achieved. And thanks to our funding partner, Charity Water, our program annually supports for improved drinking water to 30,000 people and 10,000 students on average annually in collaboration with Charity Water. Why this YG scale is important? Let me briefly introduce this slide having a functionality map. It is a live dashboard. It is from one of our working municipality. With this color code, you can see that these green are the color code having sufficient water at the water point. This red is no water. Yellow is limited water, and another color has sufficient for drinking water and sanitation, like that. So let me ask two questions. First is, WASH services are available, but do they really reliably meet the need of the people? Another question is, WASH services are accessible, but do they are satisfactory for users' need and address issues such as worry, anger, or shame? These are the psychological aspects to manage WASH. So from these questions, actually, we started WISE survey, because we have a very good, robust monitoring system, because we have been doing partnership with Charity Water. We do functionality monitoring, we do water quality monitoring, and we also have other like management aspect of the WASH services we regularly monitor. But again, while doing all these, we thought this measurement of WISE scale would have worthwhile, and we started our WISE initiative from 2021 when we first time collected baseline data, and also we collected inline for that cycle. Later from 2023, Helvetas has strategically decided that this WISE scale monitoring will be a mandatory key performance indicator, and now it is also mandatory in charity work projects. And in 2024 we also applied in post implementation monitoring, especially this is done after 4 years of the construction of the water project, so it is carried out in the old projects, and now we have been collaborating for this in WISE scale testing. Here you can also see this diagram in the publication as well, I have taken from there, and this is the baseline and inline finding. And here the interesting thing is at the baseline about 21% of the household they have this moderate water insecurity, but at the inline only 1.3% of the people have moderate water insecurity. At the same time, this low water insecurity has been significantly increased after the project intervention. In the right hand side we can see this scale was scored for different 12 items. Here this worry and angry part, it has a more score in baseline survey. Also water needed for growth also have a higher score. This is finding from this post implementation monitoring which has been conducted after 4 years of implementation. At this stage we have this 81% of the water point are functional, 14% are partially functional, and 6% are non-functional. While doing this WISE survey again in this in this context, the prevalence of household water insecurity has been found 7%. You can just see the baseline and inline also. In the baseline is 21%, at inline is 1.3%, at this PIM is 7%. So the interesting thing is there is a disparity among the districts. Surkhe district have highest score, while followed by Doilek, and Janarpur has the least score.
This is inline data?
This is after 4 years. This is not inline. So baseline and inline in first slide, but we also conducted in the project which were constructed before 4 years in old schemes to see their effectiveness. Now this we have started collaboration for in-WISE scale testing, and the survey will be conducted in 2 districts, Surkhe district and Bardia district. There will be 10 healthcare facilities. They will be all in Bardia district, and school. We will conduct in 10 schools, 5 schools in Surkhe district and 5 in Bardia district. So he has already explained about this cognitive interview and surveys, so I will just inform about the numbers only. There will be 20 students and 15 staff in school for cognitive interviews, and 20 patients and 15 staff in healthcare facilities. For the survey, we will select 300 students and 250 staff from school, and also 300 patients and 100 staff in healthcare facilities. So individual will be recruited from primary and secondary school, and for healthcare facility we will select from primary, secondary and tertiary care healthcare facilities. These institutions will be from peri-urban and rural area, both area we have. And for this actually for the research work, this approval from ethical approval is also important, and in our country we have Nepal Health Research Council which give ethical approval, and actually this is related to human health, so we need to go for Health Research Council, and for this we need to submit this proposal online, and then this NSRC do screening. After screening, they do the review and also provide comments on proposal. And finally, if we got approval, then we can start the research work. After that, NSRC also conduct monitoring and provide feedback. And finally, we need to submit the final report to NSRC. So this is the process, and we already have registered, but still it is under the process of getting approval. So this is my last slide, and for this field level data collection, our next step is we have a plan to conduct cognitive interview in December and January, December this year and January next year. And there will be a debrief with invoice team to incorporate cognitive interview into surveys. Similarly, we will conduct this survey during January 25 to March 25. Then data will be processed by invoice team. Josh is here. And we will do this quantitative and qualitative lesson learned debrief after this data analysis. Thank you very much for your attention.
Again, I'm going to ask just suffer through, or not suffer through, enjoy. One more presentation. The data are on the horizon, actually, so I will say, last but not least, in this long series of presentations, before we get some questions, move around a little bit, we'll hear from Marissa. So thankful she has, you've heard me already compliment her now. I'll continue to do it throughout the rest of the conference in private, but she has actually worked with her team in country to implement in schools and healthcare facilities, and we'll be able to provide some of the context of, so Manon was great to share what does it kind of look like, nuts and bolts of like getting the process. IRB can be a slog, but Marissa's going to share with us what she has found to date. So Marissa.
Thanks, Josh, for this introduction. So I'm Marissa from Eawag, a Swiss Water Research Institute. And actually I'm happy that Madame already gave you the big picture of how we are doing this. So I'll go more into details of practical examples, how we implemented that, also showing you some first results that we have got in Uganda. So to give you a brief overview why we're doing this, so we're already with Eawag. We have an ongoing project in small towns in Uganda together with Makerere University, which is the university in Kampala. We're looking at the interconnections between water, sanitation, and solid waste management, and how we can plan for a more integrated service level provision. And so we're working in two small towns of around 20 to 30,000 inhabitants, so you can see it on the map. And so when Northwestern University approached us about this invoice scale, we thought well, that's basically it fits very well into our project, because we are also then assessing wash and solid waste management in schools and healthcare facilities. On the provision of basic services, but then it would be actually nice to also have this invoice, the user's experiences to compare to each other. So that's how we partnered. So I'll go a bit deeper into the methodology, how we got to select the different schools, how we did the cognitive interviews, etc. So for the schools, you can just see a small map of the schools. We had 5 in each town, and we selected them based on, we wanted to have a diversity of schools. So based on the location, we wanted urban, but also peri-urban rural schools, both primary and secondary, different sizes, and also public and private. Sorry. And then, so we did the cognitive interviews. There are 5 sub-themes. You will also see it later in the small exercise. So it's water, sanitation, hygiene, solid waste management, and also menstrual hygiene. And as Josh explained before already, so the first step is doing these cognitive interviews to truly understand how the questions are perceived by the interviewees, by different groups, by students, staff, within this context, and how can we phrase them in a better way to make people understand them. Just to give you a couple of examples. So basically most questions were quite well understood, but then there were some where we had to rephrase them slightly. So for example, I'll just read this question. How often were lessons or other school activities altered, disrupted, or cancelled due to water problems at school? So first of all, when we talked to the participants, the how often, actually they were trying to count the times, how many times this occurred. So it was actually much better understood when we directly asked how many times for school activities, etc. So that was one small change that we did. Then, for example, the lessons, we actually interviewed also not only teachers, but cooks, cleaners at schools. So it was like more school activities in general, so we crossed out lessons. And then these three terms of altered, disrupted, or cancelled, it was quite heavy on the respondents. So they rather thought of it of like how were these activities affected. So it kind of gives a bigger picture. And then, yeah, these can be used as examples. So it was also like much conciser and easier understood. And then for some other questions, we actually completely removed them or put them together. So we have here an example of healthcare facilities. So it was, how many times did you worry that problems with water availability or quality at the healthcare facility would pose a risk? Either first question to the health and safety of patients, and then the second question would pose a risk to your personal health and safety. And through the cognitive interviews, we saw that most of the people actually, they all answered the same answer to these two questions, because whenever it would pose a risk to patients, it will also pose a risk to themselves. So in the end, we just combined these questions into one. Yeah, so I'll focus the presentation on schools. I won't talk much about healthcare facilities because we just ended the data collection in healthcare facilities, but we've done the schools before, and we already have some results which I will also show. So I'll focus more on schools and the process. So first of all, how did we recruit the students? So we had, as I said, primary, secondary students aged 7 to 20 years. Around 10% of all students were surveyed, and we tried to have like equal distributions among all ages, among all grades. So the way we went about that is through the head teachers, the deputies. So we had to introduce the project to them first so that they truly understand it, and they really helped us in this whole process of getting the students actually. So in the end, what worked best is to do it during class. So one by one, we would get the students from the teachers, do the like 15 minutes to 20 minutes interview or survey. And yeah, for the consent process, since we're working with children, we also adapted the consent process to get consent from the caregivers at school, so the teachers, and of course we got also the like the verbal assent from the children. It was a bit more straightforward for staff, of course. It's adults and different classes of staff, teachers, cleaners, cooks, etc. So through these surveys with students and staff, we could then establish like these in-wise items, and then so that's just the number we reached with these surveys. And then for the observations, we did observations and also water quality testing. so that we can also quantify like what are the JMP service levels in these schools. So I won't go into detail on that, but it's an adapted JMP service ladder with also solid waste management in it, which we created for now. So that's normally not present in school, but it's really important. So I won't go into detail, but it's basically like what you know. And for example, solid waste management, a basic service would be when you segregate the waste, gather it in containers, and you safely dispose of it on school grounds. And then advanced basic service level would be outside school grounds. So I want to go through an example with you of one specific secondary school in one of the towns in Northwestern. I think it's nicer for you to really get a feeling of how this school works and then what are the results. So for example, here they are taking groundwater, storing it in a tank, is on school premises. Then for the sanitation part, there's separated pit latrines. For staff, there are actually locks on the doors so they can lock it, not for the students. You can see in the picture here, there is an incinerator behind the girls' toilets for menstrual pads, so that it's supposed to be used for burning the menstrual pads. There was no specific hand washing facility for the students, so they just went to a borehole, which was also around the school, to wash their hands. There were jerry cans for staff in front of the toilets. And there was some segregation of waste, so you can see here the plastic bottles, which would be collected by informal collectors. The rest of the waste was openly burned. So first of all, for the JMP, we can see, so it's the number of, so we had 10 schools, and we just plot the percentage of schools that are then classified in a basic service, limited service, no or poor service, and advanced. So for the water situation, since it was on premises, water was coming from an improved source, it's a basic service. I plotted it for students and staff. So we can really see that the staff situation for the sanitation is much better. It's an advanced basic service, whereas for students, most of the time it was the locks that were not present. That's why it's then in a limited service, which was also the case in this school. Then for the hand washing facilities, no service for students, whereas staff had a limited service. So also here you can see for hygiene, in general, overall, these 10 schools had a better service for staff because of the presence of soap mostly that was rather there for staff. And for solid waste management, since like 8 out of 10 schools actually had open burning, they practiced open burning of the waste, so they're all classified in the no or poor service. Now, that's like the very first results from the invoice. So it's still a lot, of course, and you can probably not even see it, so I'll go step by step and won't talk about everything. But we plotted the results for students and for staff, and so the darker colors are when users were answering many times to the questions, so that's like a bad thing. And then the lighter colors, it's when they answered never. So just go section by section. For the water, we can see that, well, it was classified as a basic service actually with the JMP letters, but we can see that the 2 items, worry and thirst, so that they were feeling worried and thirsty, especially for the staff, was actually quite worrying. So yeah, that's like one example of how psychological factors are actually also affecting. And this can be an indice that, for example, there might be times where there is not enough water, so the water quantity might be an issue. Then for the sanitation facilities, what we also saw in a lot of schools, probably those who are working in this context might have similar experiences, the dirtiness and smell of the sanitation facilities were often a problem. And then, for example, for the students, a lot of them mentioned they had no materials, so no toilet paper. And this is, for example, something that's not directly assessed with other indicators. So this is a really interesting finding that we have through this in-wise data collection. Then for the hygiene, there was no soap, and a lot of students reported this. Interestingly, for the JMP, we didn't see soap in the observations, also for staff, but they have not really reported that. So even for the staff, they are, when we asked about is there enough soap, most of them said, yeah, it's not an issue. So that's also an interesting finding, to always be able to cross-compare between indicators. So it's showing the complementarity of indicators like JMP that are service-based with these more experience-based ones. Then for the waste, so solid waste management, it was quite concerning, like especially the staff had like quite bad experiences with waste management. So we asked about classrooms and school grounds, how often they see waste lying around. Actually, interesting finding was that on the school grounds, a lot of people said there's many times like it seems dirty, but then when we asked why do you think that, it was just the leaves from trees around. So yeah, that's like one thing we can think about for next data collections. Do we want to adapt that? How do we go about this? Go to menstrual hygiene, which is, I think, a really important topic. So findings from this school was first that some people reported they don't have a safe and clean space to manage their period. And then one really interesting finding is that the disposal of menstrual pads were a problem for quite some people, and they actually reported to just dump them into the latrines, although, as you saw in the picture before, there was an incinerator at the school. So, for example, in the latrines there were no bins or whatsoever to put these pads into them. So, of course, then the only option would be to throw them into the latrines. So that's like another finding, and which is interesting, although there is an incinerator on the school grounds. Yeah, how can these things benefit and add value to the overall assessment? I think also like we can assess gender-specific experiences. So I don't have the data here, but it's really nice to be able to see differences in gender, but also in the different groups, students, staff, different staff members. And then what we are trying to do locally in Uganda right now is to use these in-wise data together with the JMP data that we collected to provide very targeted feedback, and also like to come up with recommendations for the schools on how these services can be improved. And so it's just an example of like a one-page summary report for the schools, for a specific school, with very easy to implement recommendations, improvements, or like where to target the investments. So I won't go into details, but yeah, that's what we're trying to do right now. And what we've learned from this entire data collection I think it's a really promising next indicator. Well, it's not yet a scale, so I won't say scale, but it's getting there, and I think it's very useful to complement also the already existing indicators with some real experiences from the people. So it's not a finished scale. It still needs improvement. One thing I would point out here is, for example, the waste items. As you saw, there were just 2 questions for the students, and there was nothing about, for example, the open burning, like how do they feel about the waste management? Is it properly managed? So I think that's something we could like think about and add for the next data collections. And yeah, there was quite some interest locally in these small towns to really also apply the tool and to be able to target interventions and monitor also on a longer term. So of course, like the next steps, that will be with Josh. I'm happy I don't have to do that. To refine the items, also validate the tool in probably a year or 2. Let's see. For now, as I said, we're also going to disseminate the findings, of course, to the schools, but also to the local governments, provide some recommendations for more targeted interventions. So we're very closely in touch with the local government, also working like on the bigger project. Yeah, and we're also doing invites in healthcare facilities, so we've done data collection, and right now we're also looking at seasonality, so we're doing it in dry and rainy season and trying to compare what are the differences. So this is actually a master thesis from a student at McGill University. As you can see her sampling some hand washing water here. Yeah. Yeah, and actually I just want to also thank, even though they are not here, I had a team of enumerators, 10 enumerators that were doing this work, so it's not like what I've done only, but it was a group work, so it's really nice to, yeah. Thanks.
Yay, that was, I'm beaming. It's the first time I've gotten to see some of these findings as well. Okay, that was a lot of information. That was a lot of speaking, an hour's worth of speaking. I want to take some questions if folks have them for anybody that's presented. We have a little bit more after that, but we can take questions for maybe about 10 minutes. So if anybody has any, raise your hand. I'll try to field a few of them and then dole them out respectively. Nice.
Thank you, Josh. I have a question for you and Marissa. We also did surveys in healthcare facilities, and sadly we did not have your invite scale, but we saw a very big desirability bias, especially in the staff, that they really want to report positively, even though you see then after that, if you observe and if you speak with them privately, that they are not at all satisfied. Maybe in Uganda, do you have similar experiences, or in general, how do you think of addressing this problem?
I'm going to take just, if there's any more, I'm going to try to do what I saw some of the JMP folks do, in case there's a lot, but any other questions?
Thank you for the presentation. It's really useful, and the data is really interesting. I was wondering if there was an intention to take the data beyond dissemination. Is there, thinking around utilizing the data to influence some type of course correction or to influence practice at the service provider level? Because I would imagine that in itself is another piece of work, and to also be able to have a facilitated process of interface between the service user and the service provider to bring about some type of change.
That's a great question. I'm also encourage folks in the chat. I see our online colleagues. Okay, I'll flip through these. I'll be kind of reading them. If there's, I'll take one more in the room, and then it'll be too much of a cognitive burden for me to remember. But any other questions?
You you explain it, is the survey tool different for schools and healthcare facilities, or is it the same tool for both? And if it's, well, either way, I'm
Yeah.
curious like how you deal with interviewing students and patients, or just interviewing staff?
Yeah. Great questions. I will answer some of these and then turn them over to folks to fill in all my gaps. And Chris in the chat with lots of great questions, which I'll also try to address. So the surveys are different for healthcare facilities and schools, and they're also different within the two different target populations within both. So folks in a moment will be able to come up and look at some of the items and see how they compare between the different types of groups. So again, there's like four flavors we have right now. There's staff in schools, students in schools, and then within healthcare facilities, it's patients and staff. Different sets of questions, slightly different recall periods, given that you can imagine patients are just typically maybe only coming in for one or a very brief visit, whereas staff are working there for regularly. So very different exposures and experiences with those. So we've tried to capture those and reflect those in that. I'll let Marissa maybe speak to, and others who are about to implement, what it's like trying to recruit patients, because that has been really tricky and new for me also. So if you want to share, I don't have a speaker to give you, so come on up.
Yes, thanks for all the questions. So regarding the recruitment of patients, it was quite tricky in the beginning. So we, again, like we tried to really first have a contact with the healthcare facilities, with the director or whoever was in charge. Try to tell them what we want, like how should we go about it. So our first approach was to go to the patient's household. So actually we worked with village health team workers, which are, so each healthcare facility in Uganda has these, they call it VHTs. And they really know their patients quite well. So they're like each village, like they really know who was there. So they have their contacts. So we worked through them to get to the patients. And first the approach was to go to the patient's household. So we scheduled a time that would work for them. We went there, but then we realized sometimes it just takes really a long time to go there. Sometimes they're not there, all these things. So our second approach was to then call them and ask them to come to the healthcare facility. And that actually worked out pretty well as well. So it all depends, I would say, on the context and whatever works best, in a specific, even like we did like a mixed approach of these things. So each healthcare facility kind of preferred their own scheme, and so that's how we went about this.
And,
Maybe, so there was the question on if we are thinking of going further and also looking at how to include the service providers into that and into telling them about the results, like what should be improved. So we are very close in touch with for example, the water utilities or the town council, who is providing solid waste management services, like pickup services. So definitely we will also be in touch with them for giving them the bigger picture of what we found. We are thinking of course, like having a summary, giving it to them, talking about like what could be the improvements, even maybe having a policy brief. So that's for sure also a goal to like improve the entire service. For now let's say we're not there yet, but it's in the process.
And to say it's early days, so we are trying to figure out how best to present these data too. So if you have any analytic things or things that would make it more compelling to look at, that would be helpful, because we want these to be approachable by a lot of people. And to say we're also working with implementers and folks who are actively doing interventions alongside these. So hopefully this is also helping to monitor and evaluate their interventions so they know whether they're effective or need to be changed with these new types of data. So beyond just dissemination, like you had said, there were local partners who I've only got to speak to a couple times on Zoom, but I think there was real interest in also training them on how to use the tools, or like what does it look like once the scale's fully developed, because they said, we don't want this to be a one-off thing, we would love to see kind of the change over time. So helping folks be able to do that and make it, hopefully the ideal with this tool also is that it's very easy to implement. The Y scales for the other settings have been very easy, and all sorts of community groups have been able to take them up, and we're hoping that it is also pick up easy, and then Scott over here has done plug and play type of data analysis so that it's also easy to interpret the data. So we'd like to do the same for NYs. The last question before I see others is desirability bias. I'll say what I wrote in the protocol, but then you can tell me what it was like actually being on the ground. In the ethics, of course, we are trying to communicate in people during the consent process that there's no, your answers do not impact your school achievement, there's no intervention tied to this, that it is totally private, confidential, that these will not be used to impugn you or cause any harm. Also, the interviews are done in as private setting as I understand is being able to do, so that people really feel like they can give maybe an honest answer and kind of like what you were saying, pull people aside, be like, what do you really think about this? And I think some of the data were showing that people, at least in this one setting, weren't always saying that things were rosy or happy. I can appreciate that obviously does occur. I'll let you fill in.
Yeah, so what we had in schools, typically, I'll go for schools in Uganda. So I remember one setting where the first day we started, the idea was to have like a teacher or like an adult person next to us just to make sure everything goes well. Yeah, so in the end, what we realized is that actually the students were not very comfortable with the setting, and they would not tell you the entire truth, because they thought like, oh, maybe if I say something bad about this school, that will influence something, like what their relation with the teacher, their grades, whatever. So we realized that very quickly, and then we changed this to be more like, that's what you saw also in one picture, where it was more of an open space, where we put small chairs and the enumerator could sit with the student, and that was like kind of a private setting, but not like behind closed doors where you don't know what is happening. So it was an open setting, but far enough from any like director or teacher that would overhear the conversation and make the student feel bad. So yeah, we tried to have it private, but in a way that would assure that everything is going all right.
We need a lessons learned paper, we need to jot all these down. I saw another hand raised. Yeah.
Yeah, just wanting to know in regards to your healthcare facilities. So I work in Salvasia on hospitals and healthcare, promotional healthcare. So I was wondering in regards to the patient and user experience. So I imagine it would be very different if it was a clinic versus if you're going to have spent overnight contact time. So I'm wondering, in your healthcare facilities, could you give me a bit more detail? Are there a clinic sort of base where it's a short visit? And then in our experience in Salvasia, when you try to probe patients more about their wash experience, they're like, oh, we're just sort of stopping there for a quick visit. So you're not as hung up about it. And versus the ones who have to spend a protracted period of time, and especially I think for, we know in mums, access to wash is a big determinant whether they go public or private. So those are the things. And lastly, I think I was curious whether you're going to cover environmental hygiene as well as that user experience, because that's also a big determinant of healthcare facility choices.
Yeah, I can maybe answer this one. Thanks, it's a really important question, and I remember having this conversation with Josh actually before starting. So we actually targeted more the inpatients, so those that are actually staying at the facility. So we didn't go to hospitals, since as you saw, it's small towns, it's more like clinics. People stay there a couple of days, like, yeah. So we targeted these. Then, of course, like we also had patients that would just come for a day. But yeah, it's just because they would have like more of an experience, for example, with the sanitation facilities. That's why we targeted these. But it's also interesting to actually see both sides, and with this tool, then we could also have a comparison between inpatients and outpatients. So we did have both, but we had more, let's say, of inpatients.
I'll add to that and say, yeah, there is the plan, like that's a huge question of doing this for the first time. So the data are coming in, there's other settings where we're gonna do this, and also targeting outpatient, like, well visits and other things just to understand if this is truly something that can be captured in this population, or if it needs to be somebody who's staying at the facility and has potential more engagement with these facility types. So I think the patient population is the one that is the biggest question mark with this study. And I'm excited as once we get to go into the data. There's also the question of environmental hygiene. Yes, that is also part of it for healthcare facilities. That's one of the key ones. I'm gonna go in the order that I saw them. I'm sorry.
Okay, I will try to ask you my question, and Anaïs will help me. As you mentioned, GMP questions are about availability and accessibility, and it's easy to ask people about this question. But using is about psychological question. Sometimes it's difficult for people to be open when you ask them to reply clearly and to be confident to give you a good response. How do you use to train interviewers to ask people good questions and to be sure to have a good data?
I love this question because it gets at the heart of kind of experiential items, and it's as good as the relationship is with the respondent and interviewer sometimes. So we're trying to work with partners who have an established relationship or know these communities well, so that people feel like they can give an honest response. We're trying to also develop questions that have a lower cognitive burden, or ones that get at the meaningful experiences without producing feelings of shame or these more things that might be really sensitive and people don't want to talk about. Although we are talking about sensitive experiences like using a sanitation facility, menstrual hygiene. So I think it's talking with people, trying to make them feel comfortable and know that their responses are confidential, and that this is, there is no harm to come from these data. That is a great question. Yes, please.
And my second question is not a question, but it's about Terre in Mali. As we discussed, is interested to pilot this experience.
Yeah.
But I'm here, but for me it's very interesting to understand the different steps to pilot this experience, and I'm very happy to see different experience, but about in scope, and I'm sure the contexts are different, and in healthcare facility, perhaps in French-speaking country, I'm sure perhaps the situation is not the same, and it's a good idea to make a test in this zone like Mali, Benin, Niger. And I'm advisor, and they ask me about in Wise. And if I return in Mali, I have to give them to reply to their question. And because they expect to go deep dive to try, and it will require some effort and also perhaps some money, and it's a risk for them to invest in this research. And I want to know perhaps we can discuss about this with John too. How can be our support about data analysis and also survey? How can you help them, for example, to implement or to test this experience?
If I can just jump in here, so you are all learning about this at an interesting, in some way more difficult moment than we're at with the HYs or the IY skills, because we're like building the bicycle as we drive the bicycle. So there's very clear training messages that we have established for the final magical 12 items in this scale. But as you can see, we came up with some garbage questions to ask people that need modified, and we forgot something, or we did not clarify leaves. I mean, so we don't have the concise training that you would like to bring back with you to Mali, but we do have like guidance, and this is also a pitch for why it's a great idea to come on board this bicycle that's moving, because you can improve the scale. We have things to learn from you. We are not here saying this is how you do. We're saying like, listen, we're trying and poke holes in it. So I need your difficult questions to stress test what we think we're doing. We don't have beautiful training materials right now because we don't know the final questions, but by the end of it, this should be a 4-minute endeavor with clear training that you'll help us to develop the training materials for.
And like we have we have a ongoing document that hopefully will be shared within a couple weeks for our implementers too, so that list of resources we can provide you based on your experiences in the field and other folks. We are trying to develop like a concise document that will be a living document of best practices, lessons learned, additional probes you can include for people, things to avoid, so that's forthcoming, and hopefully before your implementation, that'll be available. But yes, exactly what Sarah said.
And can you mention co-authorship too, like as this?
Oh, well, yes, some people always, co-authorship and thinking about what, like the data sharing agreements that we have too. We also have a protocol of what it looks like to join a consortium like this, and so if you do join on, there would be very open collaborative co-authorship, and each site is contributing multiple named co-authors, as that is how it should be, because a lot of people are putting in a lot of time and work. We've done this similarly with the WISE scales and have found consortium co-authorship to be really valuable, and then also named co-authors, and we have protocols for that, but as much attribution and recognition as is deserved from all of the hard work people are putting in. So it's a really great point. I will take one more question. I will then, oh, I feel so bad, there's so much. Yes.
I was curious about the comparison between the JMP data and what you're finding. So, like for the last example, what percentage of those 10 schools would reach the basic service level for the JMP definition, and what percentage would be considered, to meet the in-life scale? And I saw that you kind of integrate them, and it was an adjusted JMP ladders. Were the basic definition adjusted, or was like added to? So kind of two questions there, sorry.
Oh, I'll just add that you're signing yourself up for feedback. No, on these one page here, you guys great. But these one pages, and this is another example of where we don't have a scoring rubric yet, right? Like we have now cutoffs for low, medium, high with the Y scale, but we don't know what the final range of the score will be, so we can't quite do like prevalence estimates, but I'm excited for what Marissa showed us today. I haven't seen it before, so I'll let her answer that question.
Yeah, so we didn't perform any like statistical comparisons between like maybe the items and the service levels of the JMP, which would probably be interesting, but since it's not yet a scale, and we don't want to aggregate these and really draw conclusions yet. And regarding the adjusted JMP service ladder I showed here, I just called it adjusted because especially the solid waste management scale, that's something we kind of came up with, and actually at Eawag in the solid waste management group, they're working on this. They're working on a scale for solid waste management, like similar to a JMP, because it's just not existent and it would be very useful. And then I just adjusted a couple of things for the advanced basic service, because this is, even if you look at the manuals, the guidelines, advanced basic service, you can kind of define it yourself. Like you can look at what is the national level. So for example, yeah, great.
It may do some weird stuff for you. I click that button a lot of times.
Let me give you an example. Okay, so for example, for sanitation, the basic service is an improved sanitation facility, single sex and usable, meaning available, functional, and private. And then we define the advanced basic service as the same, but it respects the national ratio of students per sanitation facility. So, for example, in Uganda, the national ratio is 40, so 40 students per facility. And when it was, let's say, 100 students, then it was just basic, but not advanced basic. So there are quite a lot of different criteria you could use for defining your advanced basic service, but that's kind of like an open slot.
Can I
Yeah,
make one
that's
more
fine.
comment? So really quickly, I would say, if you really want to get excited about this, we do have some papers that do have HYs and JMP data next to each other that have come out recently, and I think that's really interesting to start to look into it. And I think one point that I really emphasize is like, we don't want to replace JMP indicators. These are tools that work together, and so to kind of see, what are you seeing in areas where you have basic service versus advanced service, or whatever that looks like. We just did this in Madagascar with household level data, and we were seeing these big differences between JMP data and HY's data based on like drier areas versus wetter areas, even though, they, like wetter areas didn't have good drinking water quality, they still had really good water security. So like, again, these tools work together, and we'll probably see more of that at the institutional level, but we're starting to really tease that out in more of the household scales, and we're getting a lot of requests from your team to see that kind of data together.
No, we're excited.
Cool. Yeah.
I appreciate the enthusiasm and questions, and I want to address all those. And I want to also be respectful of people's times and snacks and coffees and stuff. So looking at our time, there is another presentation forthcoming. I want to say before you leave this room, we were gonna do an exercise for people who are gonna get to practice trying to do the cognitive interviews. I also had a feeling that we might run over. So please feel free to come up and just get one of these. So this is the cognitive interview guide. It is not the full set of items. It is a small subset of items to give you a flavor of them. We aren't acting like this is proprietary. If you want the full set of items, please message me or Christina. We have QR codes, we've been sharing them. It's just wanted to save trees. So we have each of the four, and you can kind of get a sense, take one, take multiple, take whatever one is the population you care the most about before you head out. But I also want to turn it over to long-standing partners who've also been doing a lot of great work for the WISE scales, and I can speak on their behalf. I think interest in the influence tools as well. So I want to turn it over to Scott, speaking on behalf of also Tessa as well. So yeah, please.
Yeah, thank you, Josh, and thanks everyone. I will try to keep this really brief. I know we've got a couple minutes left and it's at the end of a long day. But I hope this will be brief and I can leave you on a motivational, inspirational note around our perspective and really my perspective over the last couple of years. First, being exposed to this larger WISE family, the incredible work that our partners did, first adopting HYs in Nepal, bringing us into that picture, bringing us into the larger WISE family, and why we feel so excited about using this globally moving forward. So I'll do that very quickly. Brevity is not my strength, so you all might just leave and I'll be here tomorrow still. Okay, so very simply, Charity Water is a funder of global WASH programs. We currently work in 22 countries in Sub-Saharan Africa and Southern Asia. What we do is we fundraise, we go out and find some of the best implementing partners in each of those countries, and we grant funds to them. To date, we've been doing this since 2008, about 18 years of work at this. Charity Water has raised more than $1 billion for clean water, funding 150,000 clean water projects across 29 countries, and those projects will serve nearly 19 million people with clean water. But the model that makes all of this work is quite different than you see from most funding partners, especially in the wash sector. We do not have a large endowment. We do not have a base of funding that we are drawing from. Each and every year, we're going out to the public and we are raising money through direct person-to-person fundraising, finding corporate partners, finding foundations that are interested in supporting the work that our partners are doing. We pool that funding together, we grant it out to our implementing partners, but as many people in this room know very well, that when you're working with nonprofits and you're trying to raise money, if the cycle ends there, so does everything else. You take in money from donors, you implement projects, and if those donors never hear back from you about how their money was used, there is not a next round of donations to go into implementing more funding. So what we have invested in heavily in the last several years is working closely with our partners to measure the impact of the work that they're doing on the ground with Charity Water funding, take that nuance, that understanding of the impact that clean water projects can have on people's lives, and package that into storytelling that can re-engage donors, bring more people into the wash sector, and essentially start this cycle over again. More funding means more implementation. More implementation means more data collected. The more data we can collect, the better stories we can tell about the impact of clean water and start the cycle over again. And so that's really where we find ourselves when WISE enters the picture. So Charity Water works with its partners. My colleague Tess and I are working with 57 partners around the world on Charity Water's monitoring and evaluation framework, where we are having each and every one of those partners is collecting 19 standardized wash indicators in essentially every single area that they are working in. And doing this across 22 countries to date, we have funded more than 90,000 household surveys across 115 separate program evaluations. And then enters our wonderful partner, Helvetas. As you heard the story of John Brogan, who is an early member of the WISE family, a really strong advocate for water security, came to us and said, we found this indicator. We want to test it in Nepal first and then in many other countries after, using Charity Water's funded implementation areas and the data collection that we are already doing with Charity Water funding. So can we take this indicator, add it onto the surveys, and see what happens? Now, when you put these questions and everything that we know about water insecurity and the scales that go behind it into the context of that cycle of measuring impact, proving it to donors, telling them stories, and bringing them back into the wash sector, there's obviously a lot of appeal to being able to speak to human experiences. So this was an obvious, yes, go ahead, try it, let's see what we find. And what we found really did surprise all of us. So everybody involved looked at these results when we finally got them and said, wow, there's something incredible here, something that shows a level of experience that we had not been able to see across those 90,000 surveys that we had collected prior to this. We had been measuring things like the core JMP indicators, things at sanitation facilities, at schools and at healthcare facilities, but nothing seemed to fit into that broader cycle quite the way that being able to see that the percentage of households experiencing things like worry or anger was more than 70% prior to clean water infrastructure being built, falling down to just 15% afterwards. All over here on the right-hand side, nearly half of all households reported feeling ashamed about their water access situation. Helvetas Nepal comes in and builds beautiful piped water infrastructure, tapped right to people's homes, and afterwards, just 1% of people are reporting feeling ashamed of their water access situation. So we saw these results and we said to ourselves, there's so much here, we need to know more about this. So what did we do other than get on a plane and go visit Madan in Surkhet, Nepal? And so we visited Helvetas Nepal and the incredible team that Madan leads there, implementing piped water schemes across Western Nepal. And at the end of, this is not a great picture of any of us because it was at the end of probably a 12-hour day driving across the mountains of Western Nepal, but this is a really special moment because we had talked to households about their water insecurity. We had talked to enumerators about collecting this data. We got back to our hotel at the end of the night, and we got on a video call with none other than UNC's very own Joshua Miller, who helped talk us through some of these technical challenges. So they really were not kidding when they say that being a part of the WISE family means having some technical support behind you. I'm not offering Josh up to get on a call with you in the middle of the night in Nepal, but it is really special to be doing this. He will. And it's special to be doing this not in isolation, right? We don't feel like we're adopting this indicator alone. We know that there is rigor and support behind this as we do it. And so I want to really kind of center our trip in Nepal on one specific community that we went and visited that ties so many of these aspects together. So as you can see, this is a community in Western Nepal, very rural community. And here on the left-hand side is something that will really hopefully center this for you. There's Madan leading me into this community on the only path in or out. Now, Helvetas, along with the government of Nepal, has constructed more than 10,000 of these bridges connecting rural, isolated communities. This community does not have access to a major road network. They do not have access to major markets, hospitals, other than this 1-foot bridge that you can walk to and from across. And so when we saw these results, it really helped put in perspective what we were capturing in the data. So going to a community where there's one way in, one way out, with charity water funding, Madan's team implemented this piped water system where up here at the storage tank uses gravity to flow water down right outside of each and every household. And what we really were able to see here is that what we're capturing in this is so much broader than infrastructure, whether it be the bridge itself or the piped water system. It's broader than water or health. This is about human experience, and human experience is so often dictated by the context that you're in. And so now every time I think about water insecurity, I think about rural isolation. I think about the communities for whom access to the outside world is nothing like it is for us, and for whom measuring water insecurity can really help bring donors back into this cycle. So this is exactly what we did. We have now adopted the HY scale across all of Charity Water's partnerships. We will be collecting probably 30,000 household surveys of HY's data each and every year moving forward. But we're also critically taking that and packaging it back into storytelling to complete this cycle. So after this experience that we had in Nepal, we were able to come back and package this into things that we could bring to our donors and help them understand what water insecurity is, what it feels like to be water insecure, and what the impact of donating to clean water can really bring in terms of reducing insecurity. And of course, that's only the start of this. We really do need to bring this directly to our funders and our donors. And this is another key part of what we are doing. We are traveling around and meeting our donors where they are and telling them the stories of water insecurity and telling them about the human impact that can be had by supporting our incredible partners who are implementing clean water projects. And so where I will leave you is with a broader appeal, a broader hope for this WISE family to be able to help us bring institutions into this broader cycle. So actually, unfortunately, Tess and I, my colleague, right after this session have to head to the airport because we are flying to Nashville, where this weekend we are meeting with our colleagues and donors, and the focus of that entire donation weekend that will happen this week is around WASH in schools. Schools are something that has a unique appeal to donors. Donors get brought into WASH via education, via care for children's programming. And when we can make the case that we are, through WASH, impacting children in many different ways, we also have partners all around the world that are implementing water schemes in healthcare facilities. And in each and every one of these cases, we are doing our best to measure the impact of these programs, but we need the experiential indicators to be able to make that cycle work for our partners. So I'll leave you with that, and there's so much more to be done here, but just know that as soon as these InWise tools are available, we will be very excited to be working on bringing them into our framework. So thank you all.
Okay, I think we're coming in pretty close to time, only 4 minutes over. Thank you all so much for coming out. I'm gonna leave some information out on how to stay engaged, and again, please take all of the materials. Thank you all.
That was awesome. That was also so good to knit that that way, oh my gosh.
Hi.
I was like, I know, that was great, no, I was just.
Sorry.
Also,
I work in
you're
Malawi.
like,
Malawi.
could be my main person on rule isolation and Bridgewood now too, so that's.
Incredible.
Yeah, I was like, also the book.
Okay, amazing.
We'd be very happy to facilitate the invite.
Well, please take this. I think my email's on there. I'm like, okay, that's the whole reason I paid for this. Yes. Thank you for coming out. Yeah, I would be really happy to.
Malawi or English.
Yeah.